Good morning, everybody. Thanks for joining us again today for another update on the situation in Timiskaming district. Today's event is twofold. One is to provide an update, as I said, and also to announce that we are issuing a class section 22 order under the Health Promotion Protection Act. And there will be a time for questions after as well from the press. We will be doing this again in English. I can take French questions from the media as needed. And I also want to highlight that the section that we are releasing and the accompanying documents, including a question and answer period, will be in English. The documents have been sent for translation, but they are not available yet, but they will be released as soon as we get things in French as well. So first of all, with respect to the situation, we continue to have more cases on an ongoing basis. We did announce 2 more this morning, and there's a third that we've just found out about from the north part of the district that we'll be announcing later today. Of concern, as people are aware, is a lot of the surge has happened since mid-December. We've had 42 cases now since the mid-December mark. The majority of the cases we can continue to link together. There is a bit of an increase evidence of community spread, which isn't surprising as our cases go up. We have been able to tie almost all of the cases back to an initial case that came into our area. This is meeting the criteria of what we use for what's called super shedder, as we know that some people, when they have the virus, they're more contagious than others and are shedding the virus before they even know that they were exposed or even know that they're carrying the virus. And that is the case in this situation that we're dealing with. There's pretty good evidence that this is a contagious variant of COVID in our district. That's not surprising when we see this many cases coming out day after day. I do want to reassure people, though, that there is no evidence that the variant we are seeing in town is the UK variant or any of the named variants. We're able to tell that by there are some signals that are classic from the UK variant, which are not present in the variant that we're seeing in our district. So again, there's no evidence that this is the UK variant, but there's certainly good evidence that it is a contagious version of COVID-19 that's in our area, which is helping to explain why we're seeing so many people who are contacts of positive cases developing COVID as well. Sometimes people are getting COVID despite the best measures, the proper public health measures. That happens, but again, part of what we're seeing is some people just not following the public health measures, and that's partly what we're reinforcing with today's messaging as well. There's also, with the cases announced this morning, there is evidence of a new cluster that is starting in the central part of our district. We know that it's been mainly in the northern part of the district where a lot of the new cases are coming from. We do have a new situation that's starting in the central part, and there are still some cases being announced in the southern part of the district. Highlighting this just to not have, I just try to address compliance that people, we're hearing people say there's nothing in my area, therefore I don't have to be as careful. And we just have to regard this as a district-wide phenomenon that's going on right now, even though the majority of cases are in the north part of the district. We are interconnected, and we just all have to be vigilant and especially reach out for testing if we have symptoms. So as we work with the community to try to flatten the second wave, this is certainly a significant wave that is hitting our area right now. Public health needs to have all the tools at their disposal, which is why we made the decision this week, and effective immediately, I'm issuing a class section 22 under the HPPA for all the individuals of our district. The purpose of this is really just to have as many of the tools as we can have. We can always issue individual section 22s, but by issuing a class section 22 like this, it's advising everybody in our district that they have to absolutely follow public health direction. specifically with respect to isolation. So the main power of this class section is it allows us to move quickly for those who aren't following public health direction with respect to isolating and self-isolating. I want to underline that the majority of the people we've been dealing with have absolutely been following our direction. But for those, the minority of individuals who aren't, there are now more tools of enforcement at our disposal and at the disposal of the enforcement agents that we're working with. I do want to underline that as you read through what's available to us under a class section 22 like this, that we will continue to do what we've been doing throughout the pandemic, which is very much what we call progressive enforcement, is that because this tool is in place, we're not going to automatically be moving immediately to fines or other measures. What we do and continue to do is reach out to people, explain why they need to isolate, explain the precautions and how this is protecting their family and also protecting the community. But we can now move quickly if people aren't following our direction to isolate. So if we are hearing people who are positive, who are in the community, people who have been told to self-isolate who aren't, either socializing or seeing people outside the household, we can move more quickly to fining individuals now. There are other measures beyond that, but the big thing is there are more avenues that we can explore quickly to try to get people to move to isolation. The big thing is we can now move quickly to fining people, either the health unit or municipal bylaw officers or OPP. The fines can range from $880 up to $5,000 per day for people who aren't following the public health guidelines and direction. Again, there are other measures beyond that, but we are quite hopeful not to have to move to them. But similarly, our job is to protect the health of the public, health of our communities, and we will not hesitate to do so as things, if we run into situations that are progressing and are increasingly at a risk to the community. A couple of things with the section. The people who need to self-isolate, who we direct to self-isolate, is who this class section most applies to. So these are specifically people who are confirmed case or a probable case. So a probable case is usually somebody who has symptoms with a direct link to a positive case, who has decided not to get tested or who is unable to get tested. So if people are confirmed or probable cases, they have to isolate for the full duration of what we direct. We also will be applying this to people who are symptomatic, who have reached out for testing, and while the tests are pending, it's very important that this group of people isolate. And again, most people have been, but if people are not, if they're still choosing to work or to be out in the community, we will be moving to enforce isolation for this population as well. As we mentioned before, we are really asking that even if you have any symptoms suggestive of COVID, to please be careful, to please stay at home and reach out for testing. And then there's also a provision now for those who are close contacts of identified case, as we have been isolating those people throughout. This is another category that we're seeing people tending, if they're not going to follow public health direction, it tends to be this group, where there are household contacts of a positive case. So again, the hope is you will not get it, but while you're waiting for the 14 days from your last contact of a positive case, it is essential that you isolate as well, because if you do end up converting, we have to make sure that you haven't been accidentally passing it on to others during that window. Lastly, there is some wording in the provision for parents. This is not that we're expecting parents who are asymptomatic to have to isolate, but we are expecting parents, if you can and you've got a symptomatic member at home, to isolate, but also the parents need to make sure that the children 16 and under are following public health direction. So that's the provision in there for parents, is to help make sure that they're helping us appropriately manage somebody who is 16 and under. Again, there'll be a question and answer document that will be released today as well, which will address some of these issues. And again, I can take questions to try to clarify anything at the end of our discussion as well. Reminder that this order is for individuals. It is separate from the provincial lockdown that we're all going through right now. The provincial lockdown is for everyone in the province to not go outside your household. We'll come back to this one in just a second. But this continues to be so important to suppress what is going on in our community. The lockdown did come at the right time for us with our surge in cases. And it's just very, very important that people do not socialize outside your household unless you're a single parent or a single person and where you're allowed to add one other household. Um, as we're dealing with cases, this continues to be the number one thing that we're seeing drive spread is people socializing, especially unmasked outside of people outside their households. And this continues to be so important. So a reminder, especially as we're moving into New Year's, especially as we're moving into a time where we tend to socialize, that this year we just can't, especially in our area where there is a contagious variant and level of COVID that's quite a bit higher than anything we've experienced throughout. It's just so essential that people stay within their households this year for New Year's. Just before we move on to questions, that is the main topics that I wanted to review. Again, just a reminder that the role of public health is we have these resources at our disposal, but we really are trying to work with our community. Our job and what we really are focused on is to educate, to support people, to encourage them, to make sure that they do everything they can to help prevent propagation in our community. But really, this is just a very good example of how we are in all of this together, that public health can recommend and advise as much as possible, but we really need each individual to do their part as well. If individuals are choosing not to follow public health guidance, then that's putting all of our communities at risk. And again, people can be contagious without knowing they've even been exposed. So we just have to be really careful. And that's really what we've seen over the last couple of weeks as COVID has gotten into our communities. We each have a role to play in preventing ongoing spread. We want to be as good as possible when we move out of the provincial lockdown, to not have to continue in lockdown, to not have to be in the red zone with lots of other measures that are in place in red. And this will be analyzed between myself and the province once we look like we are ready to, the province moves us out of lockdown, and we will assess that situation at that time. Again, it's not unexpected that our numbers continue to rise, and then we'll just have to see how the lockdown and the measures work to try to prevent further increasing wave through our community. Those are the topics that I wanted to cover today. I appreciate everybody joining us on a midday in December. And Caroline, I'll hand it over to you and can certainly be available for questions.
Perfect, thank you. So I just wanted to note that we did have a bit of a glitch with the Facebook Live, so we'll have to put the video on Facebook afterwards. We had a bit of a connection glitch. But right now we'll take questions from the media. So if folks have questions, feel free to let me know in the chat, and then to unmute yourself just so we don't get more than one person talking at a time. All right, it looks like Alan has a question.
Hi, Dr. Corneal. What parameters go into the decision from you and the province for going back to prior to lockdown status, if we go back to the red or orange or whatnot?
Yeah, thanks, Alan. So what the province announced for Northern Ontario is that we would be under a 2-week lockdown, and then things would be reassessed, with the most likely scenario is that each health unit's district would go back into the colored categories. The days leading into that decision, the ministry will be looking at our data. They'll be reaching out to myself to review the situation. But there are a number of variables that go into it. So the cases per 100,000, the percent positivity is one and two issues. There's a whole epi analysis that undergoes analysis. Is it just clusters that we're seeing? What's the level of community spread? How much activity is there going throughout the district? They also look at issues like how is the health unit handling the level of case and contact management? we are certainly very stretched, but handling things to date. We look at hospital capacity. We look at ICU capacity. We look at what's going on in our long-term excuse me, long-term care homes as well. So there are a number of variables that are analyzed, and they do seek local direction as well as the decision is made.
Okay. I did see that in the notice recently, you're suggesting that people without symptoms don't need to get tested. Is that still the case?
So that depends, Alan. So in general, if people are not exposed to a positive case, if they just want to get tested because they're worried they might have been exposed, that's still not an indication for testing in the province. There are a category of asymptomatic people that we direct to get tested. Specifically, if you are a close contact of a positive case, there is indication for asymptomatic testing. We are continuing to test our long-term care home employees every week during lockdown. So there are some indications for asymptomatic testing, but in general, for the average person, if they just want to know if they've had it and there's no indication to be tested, the province is not supporting asymptomatic testing unless it's directed by public health.
All right, Zachary from Radio Canada has a question.
Thank you. Bonjour, Dr. Cornell. Une petite question par rapport aux snowmobiles, par rapport aux motoneiges. Certaines personnes ont émis des craintes dans le nord de l'Ontario et en Abitibi-Témiscamingue, de l'autre côté de la frontière, quant au voyage de motoneige, donc la transmission peut-être de la COVID-19 sur les pistes, mais aussi à l'hôtel après. Est-ce que des cas de COVID-19 ont été liés à la motoneige dans le district de Timiskaming?
Oui, merci pour la question, Zachary. On entend à propos de cette situation que vous avez remarqué, mais pour nous, on n'a aucun cas associé avec les motoneiges à cette date de qu'est-ce qu'on sait. Mais c'est important de continuer de recommander que le monde, on demande beaucoup qu'ils restent dans leur district, chez eux. Ça veut dire pour nos citoyens de rester chez nous, mais pour les autres, s'il vous plaît, restez chez vous aussi. Mais jusqu'à date, aucune situation associée avec les motoneiges.
Merci beaucoup.
Brad from Northern News has a question.
Dr. Cornell, can you hear me?
Yes, I can. Go ahead, Brad.
Two questions. I noticed on your website, the bulletin regarding the Encore Club closure. Can you explain why that was put into effect? And the second question would be an update on the Tech Pioneer residents and the ECSM outbreak situations. Thank you.
Thanks, Brad. So with respect to the Encore Club, it was a situation where there is exposure that took place on December 19th at the club. We do believe we have identified an individual who was contagious at the club. There are also a couple of cases that have come out of that evening, from what we know. We did receive a number of complaints once we identified that there was an exposure. So we did reach out to the Encore Club. We did decide to issue a Section 13 yesterday evening, which effectively closes the Encore Club. Now, we know that the Encore Club and others are closed right now anyway, but we did that basically to publicly say that we are working with the club and that there will be provisions that the club will have to go through before they can reopen, outside of just reopening once the lockdown lifts. So that's the reason why we did that. We are working with the Encore Club to try to prevent something like this happening again, and there will be certain criteria they will have to go through before they can open. With respect to your second question, the outbreaks that are declared are going very well. We continue to work very closely with Tech Pioneer and meet with them daily, and there's nothing else that is developed to date from the outbreak. Same situation for ESCSM. There have been no other cases that have been identified at the present time through ESCSM. Their outbreak is almost meets the criteria to be declared over. And Tech Pioneer is just a little bit of a longer process, but so far neither situation has progressed beyond what initially was identified.
Thank you.
Thanks.
Do we have any additional questions from the media?
Yes, I have one more question for Dr. Corneal in regards to businesses in the district, specifically taxi companies that maybe have been reluctant to install protective barriers in recent weeks, and that might have contributed to spread.
Yeah, we're working closely with our taxi companies. As we announced publicly, there was a potential exposure through one of our taxi companies. We then did a reach out to all of the taxi companies throughout the district, just reviewing their PPE and their measures, making recommendations. Plexiglass is a great example. Under the lockdown, all businesses have to create a safety plan. And so we did specifically reach out to all of the taxi companies in our district to work with them to try to prevent a role with respect to taxis in spreading things. And again, things happen, and but we did have this did present an opportunity to reach out and to work specifically with our taxi companies.
Okay, it looks like there may be a question from Joe from Northern News, or Joe, was that your question last?
No.
Okay.
I do have an additional question. I'm just curious about the Section 22. Is that a proactive measure, or is it in response to a specific incident or incidences?
Thanks, Joe. I would say it's a bit of both. It's not surprising that as we get more cases and we're involved with more people and more extended people, that we're going to get a minority of people that haven't been following our direction. So it is, so yes, were situations which we're involved with. We could always issue individual Section 22, so that has always been at our disposal. We have been involved with OPP with an individual this week. The class Section 22 is more of a preventative thing as well, though, just to have this tool in our toolbox in order to move quickly. So to answer your question, both situations came into play as we made this decision.
Are there any additional questions from the media at this time? Okay, I'm not hearing any, and that was a nice long pause. So Dr. Corneal, would you like to wrap things up?
Yeah, thanks, Caroline. Thanks, everybody, for your attendance today. And there will be, so again, the class Section 22 is effective immediately. We will be following this news conference by releasing the documents, including a question and answer document. And if there's any questions or concerns, please reach out to the Timiskaming Health Unit and we can help address them. Thanks, everybody. Have a good day.